to give an intradermal injection, first you need to gather your supplies. So gather personal patient's record, MAR, drug book, and drug cards, medication distribution system, so like drug cart, for example, and then your injection equipment, so needle, syringe, and alcohol swabs. And then you can complete hand hygiene, and then you can assess your patient's record, MAR, so I'll pretend this is an MAR. And then you can determine which medication is ordered. So I decided to do the TB test, so my medication will be the tubular soul medication. Okay, and so once I do that, I can look over my drug cards for any other information about the drug that I need to know, and then I can assess the patient for allergies. And then after I do that, I can complete my first drug check medication, my first drug check. So that will be when you first grab the medication vial. So I completed my first medication check, and then you can complete your second medication check when you compare your vial medication to your patient's record, MAR, and then you can prepare medication. And to do that, well, okay, after your second medication check, you can do any medication calculations that you need, and then you can prepare for your medication. So to do that, you need to determine which needle you need and syringe. So needle size for intradermal injection is 1/4 to 5/8 of an inch, and then your syringe can be in tenths and hundredths of cc ml. And then after you do that, you can get an alcohol swab and clean off the rubber part of the vial. And then you get your syringe. After you clean that off with rubbing alcohol, you can take this apart and you need to inject air into your vial. And the air that you inject is the same amount as your medication dosage. So my medication dosage is 0.1 ml, so I need to pull back my syringe to 0.1 ml. And then take it, stick it into the rubber part of the vial, inject it, turn the vial upside down with the needle still always in the rubber. And then I would pull back my syringe to 0.1 ml, and you can go a little further to let out air bubbles. And then you can take your needle out, tap the syringe to get the air bubbles to the top, and then you can push the air bubbles out. Just make sure that your medication dosage is at 0.1 ml on your syringe. And then you can change your needle, make sure it still has a safety cap on it. So now your medication is prepared. And once your medication is prepared, we can now go to the patient's room. And when you go to the patient's room, you can have your drug cards or drug book, and then your patient's MAR. So, okay. Sorry, I don't have anyone helping me because I'm currently quarantining by myself, and the person I asked to help couldn't make it, so I'm going to try and do my very best. And that is my patient, the dinosaur. So after you do that, you can, you need to knock on your patient's door, and then walk in, introduce yourself. Hi, my name's Hannah. I'll be your nurse today. Explain what you're going to do. I'm going to give you a TB test, and it's just a little injection right here. And then you need to do patient identifier. So if you could state your name and birth date for me, that'd be nice. And then after you do that, you can draw a curtain for privacy, and then you can apply clean gloves, and then you can drop your stuff at the patient's bedside. So you can hand hygiene, apply clean gloves, and I can prepare the sites for the medication. So I take an alcohol swab and I clean the part where I'm going to be injecting, and then I'm going to be injecting into this. So after you do that, you can you need to clean the alcohol swab in a circular motion and outward. And then after that, you can inject your medication. So take that, and it needs to be at a 15-degree angle at bevel up, and a 15-degree angle. And then you can just inject like so. And then you need to activate safety handle immediately, and then dispose in the sharps container. Okay, after you do that, you can remove your gloves, and then you can place your patient into a comfortable position. Are you comfortable where you are? They say yes, and then make sure you just provide your call lights, and make sure that you clean up your room before leaving. So gather all of your stuff that you brought in, the MIR, drug books, stuff like that. Then complete hand hygiene before leaving the room, and that's it. That's how you complete. Oh, and then you need to make sure that you document on administrating medication on your MAR.